Good afternoon, Chairperson Pinto, members of the committee and staff. I just want to thank you for the opportunity to testify today. As you mentioned, I am a gun violence researcher and co-director of the University of Maryland Progress Initiative, which is a gun violence research initiative committed to conducting equitable, community-engaged gun violence research in the National Capital Region and the state of Maryland. I'm here today as a supporter of community violence intervention strategies, both nationally and on local level here in Washington, D.C. And in full disclosure, I'm also the co-chair of the D.C. Violence Fatality Review Committee. I'm actually missing my recommendation committee meeting right now to be here. So shout out to them, and the former research director and founding director of the Capital Region Violence Intervention Program, which was the first hospital-based violence intervention program in the District of Columbia, which I also worked very closely with Councilmember McDuffie to draft the legislation and language in the NEAR Act, which included hospital violence intervention programs. My colleague, Daniel Webster, who is to the right of me, and I are currently evaluating the effectiveness of community violence intervention programs, specifically street outreach intervention programs in the District of Columbia. As principal investigator for this longitudinal evaluative study funded by Arnold Ventures, I am leading the qualitative research component, which includes conducting focus groups, in-depth interviews, field observations, and digital storytelling with CVI leadership, frontline staff, and participants in CVI conflict mediation and resolution efforts. Qualitative research is critically important to filling knowledge gaps regarding the nuanced and layered work that CVI workers do that may not be captured by quantitative data. This approach also provides valuable, insightful context to CVI work by centering the voices, narratives, and stories of CVI workers and the vulnerable populations they work with. To date, we have 6 CBOs who conduct CVI work in the district agree to participate in this study. 4 are under the Office of the Attorney General, Cure of the Streets, and 2 are under the Office of Neighborhood Safety and Engagement. While there are 4, or at one point there were 4 CBOs under one's Life Deeds and VPN, our research study team reached out to them for several months via email and by phone. But Life Deeds ultimately declined to participate in the study, and VPN ultimately was non-responsive. And so I want to make a point that we reached out to them well before this incident with Councilman Trayon White. We've been trying to reach out to them for well over 6 months. And so in our site visits, we have conducted 6. We are now in our second round. We have now completed 4. So I'm going to speak from a sample size of 10 site visits. And during these site visits, while they're not focus groups, we've gained a lot of input and insight from CVI workers regarding the challenges with effectively doing this work. So I want to start with a quote from one of the CVI workers who participated in our site visit. "We are first responders. This is what we signed up for. We know we can be called at any time. We are like policemen and firemen. We are just like firemen. We are putting out fires all day. It's just a different kind of fire." So several of the themes that emerged from our conversations, one which was discussed throughout this conversation, focused on salary. And we know that the average VI worker earns between $50,000 and $55,000 in a city where the average rent is $2,320 for a 1-bedroom. So if you do the math, that's $27,000 a year, which is 56% of a frontline staff's yearly earnings before taxes. That's not a sustainable living wage. In addition, we also heard regarding the lack of overtime pay. Many of our CVI workers are working 24 hours a day because they live in the same communities where they work. And so there's never a time for a day off, which also raised the issue regarding housing assistance. We have workers who are living in the same communities where they work, And unlike other public safety workers such as law enforcement, which typically do not live in the same communities where they police, we should have the same expectation for our public safety workers who engage in this kind of work. Yet, we have many workers who are suffering from traumatic stress, exacerbation of other mental health conditions because they live in the same neighborhoods where they work. And so that we need to provide, this is coming from them, the same kind of benefits and housing assistance that we provide with other public safety workers or teachers, whether it's law enforcement, firemen, or our other public safety workers in the city. There is no hazard pay, despite the fact that many of our CVI workers put themselves in the line of fire every day. And in fact, we've had several who have either died on duty or off duty from a non-fatal or fatal shooting. And then furthermore, the inequitable distribution of resources in the CBO, among CBOs in the CVI space. And what we've learned is if you're a savvy director, it's very easy for you to tap into other sources of support, for example, to get a grant to hire someone, for example, like a licensed clinical counselor. But if you're a director of a CBO that's not very savvy, it's very difficult for you to gain those additional resources. So we see a great deal of inequality in terms of the way CBOs are resourced across the board. And then we mentioned job security. The yearly renewals of grants, creates a climate where CVI workers have no job security. Workers worry from year to year whether they will be employed, and this creates a climate of scarcity, impacts performance, morale, and in my estimation, increases the opportunity for corruption. Safety, in terms of the hazardous conditions that many of our CVI workers are involved in every day. There are no bulletproof vests, there are no badges, there are no guns, but we are asking our CVI workers to put their lives on the line without being provided the adequate safety that they need. Resources, as many of our colleagues have mentioned earlier, you cannot ask an individual to put the gun down without replacing it with something of equal value. And at times, this is a hit or miss with frontline staff's ability to connect participants with resources. At times, it may be as simple as the inability to purchase a suit for a participant scheduled for a job interview. When frontline staff are unable to fulfill the resource needs of participants, it may undermine the trust and relationships with frontline staff. We also have heard of many frontline staff coming out of their own pockets to pay for activities to take many of their participants outside of the neighborhood. And in addition, we also are seeing that many CVI workers are engaged in other forms of public health work. I visited 2 sites where we have CVIs who are distributing Narcan. And in many cases, I asked one of the CVI workers, well, how often do you use Narcan? And his response was, I'm using it multiple times a week. And so here we have CVI workers who are not only engaged in addressing gun violence as a public health issue, they're also addressing the opioid epidemic in this city. And so we're placing the burden on our CVI workers not only to take on the responsibility of reducing conflict, but also addressing a separate epidemic. And as my colleague Del McFadden would say, he frames this as mission drift. I just want to uplift and pin that. And then finally, the 2 things that we heard regarding the models. We clearly know that there's a CURE model being used by our street outreach initiative under the Office of the Attorney General. But under the 1 sites, there is no model. And I've heard mentioned today that there were 2 models. Actually, they're not. There's 1. There are 27 other sites who are left at their own discretion to engage and create whatever conflict mediation strategies they think are appropriate. And last, the staffage challenges. We know under the CURE model, each site has 10 staff members, 4 VIs, 4 outreach workers, who are covering a significant amount of territory. But yet we see under the one's office, and we have interviewed, and some of those VIs were in this room earlier, we have VIs who are covering multiple communities and multiple neighborhoods, and there's 1 VI assigned to that site. That's not sustainable. And so these differences, even in terms of the way the models operate in the city, is something that we need to reconcile. And then the last things I would say is just in terms of strategic plan, and while Pastor Golston did mention that we have multiple strategic plans, I don't think we have a standardized approach to many of the issues that we're dealing with in the city right now. For example, social media. If you would ask every single VI what is their approach, you would find multiple different answers in terms of how they approach social media as a driver of violence in the city. And so I will close with, until we complete our evaluation with the quantitative and qualitative findings that suggest how we can enhance the effectiveness of CVI programs in the district, we do not need the violence intervention budget to be cut. We need to hold the line with robust funding for these programs. I thank you, Councilmember Pinto, for your time and your consideration.
Thank you very much, Mr. Richardson. Daniel Webster, Johns Hopkins Center for Gun Violence Solutions. Thank you as well for joining us today.
Thank you, Madam Chair, and thank you for the opportunity to speak on this important issue. I really feel honored to be in this space where so many individuals have come forward to really, in search of solutions to such a pressing problem of gun violence. Just briefly, my background: I've been leading research and actually developed first course on violence prevention from a public health perspective at Johns Hopkins, where I'm a professor and scholar connected to the Center for Gun Violence Solutions. I've studied community violence intervention in Baltimore since 2007, and I regularly review research and engage with practitioners doing this work across the country, learn many lessons from them. And so what I'm going to share with you is a little bit about what we've learned, and also briefly mention what we've done to date on the current study in DC. As Dr. Richardson mentioned, we have our own lanes. Dr. Richardson is focusing on a qualitative research component. I'm overseeing the analyzing of gun violence at a neighborhood level. We've analyzed data from 2014 through July of this year. And we've done it at a very microscopic sort of level of sort of block by block, and whether they've had different CVI programs in those spaces at given times. And what we're doing basically is, through a couple of sort of state-of-the-art analytic approaches, comparing trends to see whether they change in response to the implementation of these programs in comparison to places that don't get them. Thus far, I will be very clear and frank that we're not seeing beneficial effects. We will have a more complete report towards the end of this calendar year, where we will have more implementation data and context to better explain that. But it's, as Dr. Richardson explained, we're already learned a lot about the structure and functioning of the program, that I think two things really stand out. One, he underscored, and honestly I think this may be the most important, is the staffing levels are nowhere remotely close to what other cities have used in neighborhoods to drive down violence. So in medical research, if you give a tiny bit of a particular drug and it doesn't respond, you don't always say, well, that drug doesn't work. You say, we haven't given it the appropriate dosage or strength. That's clearly the case with the programs overseen by ones, undoubtedly. Secondly, again, this has been brought up by several people, there is no real model or structure to guide the work. If you look at research I've done or other studies on community violence intervention, they're very clear underlying theories and processes that have to take place in order to drive violence down. In the studies that I've done in Baltimore, sort of a basic cure violence interruption model, we're seeing about 20 to 25% reductions in gun violence. And quite honestly, compared to some other cities, I think we're kind of bare bones. We haven't done nearly as much as I see in places like New York or Chicago. There are other models too that go beyond violence interruption to address many of the issues that we've been covering here. I think that the district needs to sort of really pin down what the model is, what's lacking. Some academics sort of confine themselves to what's already been studied. I think there is room for innovation, and that the program needs to be informed by a careful review of the shootings and the context. Already in this hearing today, people have identified system gaps that really explain why we're not getting the outcomes that we need to get. So our center is promoting an approach called a Violence Reduction Council that systematically looks at these cases in a very in-depth way to identify what are changeable things, either in near term or in longer terms. I led such a process in Baltimore. Dr. Richardson is leading some of that work here. But to give you an example, we found of almost every person involved in a homicide as a victim or a shooting in Baltimore had not graduated high school. That should tell you something about a system failure in our education system. Typically, those individuals had learning disabilities that were not addressed early. It's just one example. I could give additional ones. But if you truly want to lean into a public health approach to this, it has to be driven by the data and a system response to it. And the violence interruption is part of that. But for it to truly have the best impact, in my view anyway, I think you need a systems approach and a commitment to address the system failures that have already been identified in our discussion. I'll just close just with one message I want to be clear about is when Dr. Richardson and I started on this project, we were doing this certainly as scientists. We want to know the effects of programs, but we are coming to this space to really try to be helpful. We want to generate data that's going to tell us where we need to go, and we want to also apply our expertise in any way that we can in a productive way. There's many experts, Marcus, others, that learn a tremendous amount. We can contribute to that too. So I think I'll conclude my remarks there.
Well, thank you very much, Dr. Webster and Dr. Richardson, for your testimony and for joining us today and all of the continued research you are doing into our program here in the district and around the country. It is absolutely crucial to make sure that we are moving forward in a productive direction. And when you talk about those examples in Baltimore of looking at those similarities, we have had a major challenge in the district on getting access to that data. It's one of the things that we put in Secure DC to make sure that we could look at the consistency of what we know of homicide, people who had perpetrated a homicide and people who had been victim of a homicide, and look at the consistency of what was going on in their childhood. We weren't able to look at that before, the way that our privacy laws were set up with the Department of Healthcare Finance. And so it is very important that we continue to use those insights that we're seeing in other jurisdictions to inform how we move forward. I'm really interested in this concept that you mentioned, Dr. Richardson, around mission drift, because it is one of the clearest disagreements I hear from people in the community I speak to who do this work. Some say, we have gotten way too far off from what we're supposed to be doing. We're supposed to be focused on violence reduction. We're supposed to be focused on violence prevention. We are not able to accommodate the entire universe of real human needs that people have. And on the other hand, I speak to people all the time who tell me the exact opposite. They say violence prevention specialists will never be successful unless they can more accurately and helpfully provide people with food and housing assistance and the social services they need. So as we figure out how we move forward, how do we bridge that divide of two very real and understandable perspectives on that?
I mean, that's a great question. And I guess as researchers, our goal is to uncover like where we can find a happy medium with that, because you're going to hear varying perspectives. We've heard varying perspectives even regarding salary, right? Like, and overtime pay. Some people are very adamant about increasing the salary and overtime, and some people are thinking, well, I don't need to increase the overtime pay, I'm okay. But I would say that in terms of doing the work, I think we are placing an enormous burden on CVI workers, at least from their perception, the belief that they should be solving everything. And CVI workers don't have the ability to just wave a magic wand and solve all of the structural problems that exist in society right now. And so while I do agree that I think on their behalf, it's very honorable to believe that you can solve all of those issues, I don't think that there's the capacity or bandwidth to do it, or resources. And so when we have to be very clear about what our expectations are. And when we have CVI workers that are engaging now in addressing another epidemic, when we haven't clearly had, which is why we're here today, because we haven't addressed the epidemic that they are paid and tasked with addressing, then we need to be focused on what that mission is. But I also believe that just in terms of resources, and this has been discussed extensively today, regarding the inability to provide participants with resources that would move them away from engaging in behaviors that would lead to either being a perpetrator or a victim, or both, of gun violence. That's a really tricky task. And I can definitely say that, speaking as someone who has been a practitioner in that space, that you're often relying on the referral point to come through with what you promised. And often the VIs don't have the ability to vet whether those referrals are actually reputable. And that's where it can break down. Because if you're sending someone to an individual who they don't know, and it's based on your word and your cosign, and that doesn't work, then you may have lost the relationship with that person. And part of the challenge is in the work is, at least for VIs, is drifting away from what that mission is. When do we draw the line on how far you should go in terms of opioid addiction, other public health epidemics that are occurring in the city? We found that during COVID, switching over to providing masks and engaging in outreach work to address the COVID epidemic, right? And so I think we just need to be very clear about what the mission is for our VI workers, because they're getting a lot of mixed messages, and particularly when you have the Office of Neighborhood Safety and Engagement, where there's literally no model for engaging in it. And this is one thing I remember in our conversations, which stood out to me, is that the CURE model is like 7-Eleven, and the ONES model is like the neighborhood corner store, right? And there's one model that you can find in every city, and you can buy the same thing in every city. You can get a Slurpee, right? And you can get a Big Gulp, and you can find that in every state and every city across the country. Where with the ONES model, it's more, what is is this model tailored to this neighborhood? I'm not here to claim whether one is effective or not because we're not through that analysis yet. But I do think it is problematic to be in a city where you have two organizations that are engaged in the work and they're using totally separate approaches.
I'd like to respond to that. I think that the way many violence intervention programs are structured is you have some individuals who are outreach, some are very specifically violence interrupters, and then sites typically have a violence prevention coordinator. That violence prevention coordinator role is someone who helps with managing referrals and all of those systems. So New York City made a major investment in this approach now almost 20 years ago, and it was overseen most of those years by someone named Eric Cumberbatch, who is really an amazing leader. He eventually was deputy in the mayor's office of criminal justice and overseed the neighborhood safety office. And Eric happens to be a student of mine. He's getting a master's of public health. What Eric did to try to make these programs most effective and work well is, at his level, he was running interference to make sure that the city agencies were responsive to those needs in an incredibly timely manner and in a manner that was appropriate for the population that they were dealing with. Individuals with serious histories of violence who distrust almost everybody in every system, right? And so Eric, there are roles throughout. There's roles in a community-based organization to help with this process, but honestly, it doesn't work particularly well if you don't have someone in leadership who runs interference, addresses these system issues, and very quickly, and timeliness is so important. Finding people a safe place to be, food, just the basics, you need it immediately. And so they had that kind of relationship in New York City so that those programs were most effective. And I think that's sort of what you're aiming for now.
Okay, thank you very much. That's helpful. Try to do both a little bit, but with a coordinator role who's not the actual CVI specialist, but who's trusted.
Yeah, just to underscore, maybe I should have underscored this point, is that the violence interrupters do not have the time, energy, connections, and everything to do all of these other referrals and other things that need to happen. So to support them, you need these other pieces working because they are way overburdened right now. There's no way they can do everything with the staffing levels and the structure.
Right. I hear you. Okay, thank you both very much.
One point I would add, and I think that's the difference in the model. When you have the CURE model, you have the VIs who are actually paired with the outreach worker, right? Mm-hmm. And so they're aware of all of the challenges that the VI is encountering with participants and the needs of those participants because they're paired, they're canvassing the communities together. That's not the same model with the ones. You have 7 case managers who are assigned to be points of referral for the VIs, but they're not actually out in those communities with the VIs understanding what those needs really are.
Mm-hmm. I got you. Okay.
Right.
Thank you. Thank you both. I do want to recognize we've been joined by my Ward 3 colleague, Councilmember Matt Fruman. I'm going to turn to Councilmember Nadeau for an 8-minute round, and then we'll turn to Councilmember Fruman for an 8-minute round after that. Thank you.
Thank you very much, Madam Chair, and thank you to this panel for sharing your expertise. Dr. Richardson, can you talk more about the mental health crisis among VI workers and what you think we should be doing more of or less of?
Sure. We've heard that in numerous conversations in terms of people bringing their trauma to the work as they're entering the work. And I think we definitely need to be honest about people bring their own traumatic experiences to the work, and which may be exacerbated by doing the work. But I also, just in terms of how culturally responsive the resources are. And so I know that there are resources, and I've seen this also in my own work, that there are resources that we use as points of referral for mental health, but then people will get there and realize, as in any other, if you just took a day-to-day approach to someone going to see a mental health therapist and they're not connecting with them.
Yeah.
And so we often find that we're saying, well, we're offering you the services, but you're not taking advantage of them. We see that with our participants, right? You go into it and there, for some reason there's no connection, but this is the only place that you've been directed to. And so that often frays that relationship and taints that relationship with accessing mental health. But to reinforce my point regarding even the housing, I mean, I totally I understand that the approach is people should come from the neighborhoods where they live, and we focus on individuals who live in those neighborhoods to recruit as VIs, right? Because they understand those neighborhoods, they have the credibility and trust in those neighborhoods. But I also think there's a challenge when you're asking someone to live in the same neighborhood that they're working in. And for many VIs, I think this can ultimately present a challenge for some, because there's no separation. And so when we have VIs saying that we need to have the same kind of resources that we would see with other public safety workers, like law enforcement or firemen or even teachers that have the opportunity to live in another neighborhood that's outside of the community where they work, because they're never off.
Right.
And we hear that all the time. This is a 24-hour, 7-day-a-week job. And I can be called at any moment. I never have a point of separation unless you intentionally create one.
That makes sense. Have you seen anyone doing that well?
No.
Yeah.
But we just started. So if you ask me this maybe 6 months from now, I may have a different answer for you.
I look forward to that. You referenced a strategic plan regarding social media as a tool of violence in the city. Can you talk more about that?
Sure. So during our site visits, we hear a lot about social media. And it's pretty much an ad hoc approach, and it can vary from VI to VI, from site to site, in terms of how it's addressed. And so what my suggestion or recommendation, just in terms of strategic plan, is that we really need to, gather more data on what that looks like, between the sites and among VI workers, and then come to some agreement or resolution regarding the standardization of how we create, for example, a toolkit. How should we address it? Because in any conversation that I've had with CVI workers, some have suggested 75% of all conflicts in some way, shape, or form are tied to social media. But if we were to ask each VI, well, how are you trained to address it? Everyone would have a different response. And so it's often based on the context, and it's very ad hoc. And I don't believe at the time, while it was mentioned in the strategic plan, I think the way that social media has been used, particularly around the city and the organization of violence, has changed. And so we're not traditionally looking at neighborhoods where you have one neighborhood which is in conflict with another, and there's an extensive history of that conflict. The way that social media and music, I would also include, has changed the dynamics in the way that young people interact with each other. And so you could have a community where they were traditionally have been at odds with each other, with now young people connecting with other people from other sides of the city where they traditionally would have never hung out, now hanging out in other neighborhoods because they're connected through social media. That changes the dynamics of the way that the work is done.
So you're seeing it can be a positive.
Sure, if we do it the right way.
Yeah.
Exactly.
I was thinking about it only in the other sense where we see sometimes these beefs spring up on social media, but it makes sense that that would be two sides to that story. Thank you for that. Dr. Webster, you were talking about staffing levels not being where they should be. Can you talk more about that?
Sure. In cure violence sites, for example, violence, one of the most common forms of violence interruption, you will see 5 to 10 workers per neighborhood, depending sort of on how big it is and the needs. What we see in the neighborhood sites for ones, which admittedly are somewhat smaller, but still, you know, about two workers. And it literally is just impossible to mediate conflicts with 1 or 2 people. You cannot do it safely. And so I think that there's some basic structural disconnects between what they're being asked to do and what they actually can do with only a couple of people working in the neighborhood.
And what about our cure teams? Are they meeting the staffing levels of the national model?
They're approximate, maybe a little lower, but they're at least in the ballpark.
Okay, that's helpful to know. So we are between, like, we're at a decision-making point, sort of, with the two models, except for some would argue, and I think some you have, that we don't really know yet which one's the better model because we haven't fully implemented what the vision was. But the question is being called, right, in the District of Columbia. If you were sitting up here, what would you do?
I would clearly have one program that is coordinated to work. In essence, you need to map your program onto the nature of the problem. And violence is not sort of compartmentalized in the way that we structure our CVI programs. So I think the other really important thing I want to underscore is that we have to make hard decisions about where we can do this well enough to actually move the dial and reduce violence. Unless you're going to devote a lot more resources, you're going to have to shrink the areas where you're working. And that's just sort of a hard decision that needs to be made. So I think you need to be in fewer spaces, you need to be more intensive, it needs to be one program, and it needs to be informed both by data, but by the experience of people who are doing the work, that have insights, because some of these program models, frankly, are a little bit outdated. And for the social media component, we're starting to update protocols for addressing violence on social media in Baltimore, Detroit, New Orleans. But these are brand new endeavors, but they're really needed because there were gaps. So you can't completely always take a program off the shelf, but you can at least have a starting point and then build on that based upon the nature of the violence that you're looking at. So it has to be informed by a careful review of the violence.
Dr. Richardson, do you have something you want to add there?
No, I would echo it. I think we need to have one voice and one voice that moves to the same beat. And right now we don't.
Yeah.
We have, and from one standpoint, we have 27 different beats and 27 different voices, right? But I do agree that we need innovation in terms of where we are. Many of the models that we're using are outdated. We need to have more of a voice from the people who are actually doing the work on the ground in terms of what that model should look like, how we can improve the model, and what ways do the current models that we're using, do they really align with the day-to-day reality of the work? And what we're often hearing from people on the ground is that they're not. They're pulling pieces from the model and adapting the model to the work that they're doing. But I think we need to have a serious discussion and a hard discussion about how the ways that we can improve and maybe create a different model from the model that we've been using for over the past 3 decades.
Thank you, I appreciate that. I'm going to turn to my Ward 3 colleague, Matt Fruman, to see what questions he has.
Thank you very much, Councilmember Nadeau. And thank you very much to all of the witnesses today. This is an incredibly important subject. I have been listening to the full hearing, but came down for this testimony. And I am going to have to leave again at 3:30, so I'm going to want to use my time efficiently. First, I want to start with a big, broad question that I hope has a short answer. Have you or others done the same kind of parallel quantitative and qualitative analysis of these kinds of programs? And to the extent that's been done, which programs have stuck out as having been the most effective as we're looking at what we should be doing in the District of Columbia?
That's a great question. I wish I could give you several examples. Honestly, I can't think of one. So we've tried to do that in Baltimore, combining the qualitative and the quantitative. We were sort of a step behind a little bit in the qualitative, so we got some of it, but not in an ideal way. In most of the other intervention models, the bulk of the research has been on quantitative outcomes. And actually, Dr. Richardson is a leader in the field trying to change that, because we believe that to really learn the most, you need what we call mixed methods. You need both the rigorous quantitative analysis with the in-depth qualitative to truly learn like what's working and why, and meet the challenges that you learn.
So I hear that, but if what's more happened is the quantitative analysis, where are the places where the quantitative analysis has shown that these programs have made the largest significant difference?
Qualitatively?
Quantitative.
So, cure violence interruption model has been around the longest and been evaluated the most. And so I could point to more studies that are showing beneficial effects from that model than others, but honestly, part of that is just how long the program has been around. So some of the newer models, CRED, READY, ROCA, that incorporate cognitive behavioral therapy, behavior change with employment connections and so on. There are fewer studies. They're very promising. They're more at the individual level, showing individual change that is very encouraging and promising. But we don't have like sort of community-wide effects from those programs. So each of these program models are structured a little bit differently. So the ones that I've been looking at are more neighborhood-based, so the measures are neighborhood. Some of the models are much more intensive on the individual level. And so the research maps that. So we'll know on participants in READY, CRED, for example, fairly large reductions in offending rates. But I've yet to see sort of how that translates into community effects, just sort of the nature of how the research is structured.
It's so interesting that we really are at the cutting edge on this and trying to figure out what's the best way. And you are groping, trying to measure it as we're doing it, building the airplane as we're doing it. For us, that's a challenge in terms of looking at these programs and to what extent do they need support, increased support. It's a lot of it is new. Doesn't mean it's not super important, but it's new. I was struck, Dr. Richardson, when you talked about your outreach and the non-participation of Life Deeds in one of the other organizations, and I would think my antenna went up for me. I wonder if antenna go, how often do you confront that where you're trying to do this kind of research in such an important area and then you have somebody who won't participate?
In my work, at least in this space, this is the first time that I've encountered that.
So obviously, plenty of things in the news about life deeds that could make us be concerned, but also that strikes me as a source of concern. And it goes to, I want to support these efforts. They strike me as incredibly important and can make a real difference. I'm wondering what you see in terms of oversight structures in other jurisdictions, and maybe this goes to others. We want these programs stood up, but now we're having you do an analysis and it's periodic and we're lucky to have that, but how do other cities day to day oversee these programs?
Well, it's quite varied is the short answer, but I'll try to focus on the best approaches, at least what I see, is that there are agreements connected to the funding of what specifically is done. There are monthly collection of data on all the relevant metrics that map onto the program model. And then there are also research partnerships. Now, I want to be clear about what we're doing and strive to do, but honestly can do better, which is we've done kind of the hard work on the statistical modeling and I actually think we're in a pretty good place. So we can share what our models are telling us with monthly updates of data. So we can, and I think in an ideal situation, feed that into whoever's overseeing these programs, that they know site by site, based on statistical models, which are performing the best in terms of violence reduction outcomes. And also, ideally, connect that to what's being reported on these sort of intermediate measures in terms of conflicts mediated and other service deliveries and all of those things. So I think that's sort of what you should strive for is something's clear about what the expectations are, measures of that, and then complemented by external research partners to in somewhat regular way share outcomes.
But and again, sort of building the airplane while we're doing it, to date, we haven't really, is it the case that we haven't had that to date, but with the work that you're doing, we're getting the muscles that we could be able to do that going forward?
Well, in terms of us sharing the violence outcome data, absolutely, yes. We have more to do on studying program implementation. That'll take a little while, but it's because again, what Dr. Richardson's done is much more in-depth qualitative analysis that doesn't just sort of roll out real quickly. So that's going to take a little bit to do.
No, I hear you, but what I'm thinking about is one of the things, and I think everybody recognizes, I hope, that we need to have one program and with a standardized approach and measurable outcomes. But one thing is, how do you structure that? Another thing is, how do you structure the oversight of it going forward? What is needed in a office that oversees this, or by us on the council, in order to be tracking what's working and what's not? Because we're in new territory. You need to have close oversight over it, I think. Dr. Richardson?
Now, I think Dan and I have had this discussion regarding, and I'll speak for myself, regarding the role of the Office of Gun Violence Prevention. And I think just in terms of oversight and kind of guiding where CVI strategies should be going in the city, at this point, I'm kind of unclear on the role of that office. And I think this is an opportunity for that office to take more of a lead in this space. The one thing that I also just want to make clear, because we are saying that ONES has no model, But I do think this is an opportune time. It's probably a perfect research design that there is no model. Why? Because potentially, with the 2 CBOs that we are researching, we may find that there may be a model that they're using which may be far more effective than the models that we have right now. We don't know that, but potentially that could be the case, right? So I think when we're speaking about innovation, until we actually are in the weeds with sites, and we may find that working with one of the sites that has their own approach may be quite effective. We don't know that. And so I don't want to get a blanket statement that there's no model, right? Because I think that many sites may have their own approaches. We just don't know at this point what that approach looks like, for the record.
Okay, well, thank you very much. It looks like I have gone well over and am late for my next thing, so thank you very much for your testimony.
Thank you, Councilmember Fruman. When can we expect that your study will be concluded?
So when we applied for our grant and made our grant agreement with Arnold Ventures, we asked for and received 4 years of funding. So we are not looking at this as, okay, we'll put out results and that's the end of the work. So what we promised is that at the end of 2024, we'll issue a report. You can think of it more as an interim report. And what we hope is that the data will inform any next steps as we go out. We will be doing additional analyses for another couple years. And so there are different iterations there. And in between those sort of 2 big sort of more public reports, again, we'll be feeding the data more internally. So again, that there's learning as we go. We're not going to wait and hold everything at the end, but we're going to be sharing in the spirit of trying to inform the efforts, the planning, the oversight, and even program design potentially.
Thank you very much. So one of the things that has come up a lot today with our public witnesses and over the last several months is this concern that there's not an assurance by the CBOs that they will continue to receive grant money, whether that's in a future year or even be able to be reimbursed. And we have this challenge, which you may have heard me talk about several times today, about our anti-deficiency statute, which disallows us from allocating monies that are outside this next fiscal year. We cannot be the only jurisdiction in the country who has similar budgeting challenges. And so have you seen other jurisdictions that you've worked in overcome this need to go through an annual budget cycle, just like we all do, but in a way that can provide this work a little bit more assurance that they will be able to continue in years into the future?
So I want to be clear that I have not conducted any systematic study across, lots and lots of cities, but I'm in spaces where these things are discussed all the time. I honestly can't think of another city that has 1-year contracts. Typically, it's 2 to 3 years is what I see more normatively. And I guess the thing that I want to really underscore is if the District of Columbia government is going to be serious about community violence intervention as a core component of public safety, you have to, if this statute is standing in the way, I would just say that you need to somehow get over that or get around that, because the work being done, or there needs to be some other kind of assurance to the people doing the work and those organizations that they can count on the funding. Lives are really in the balance. And this is really hard and sometimes demoralizing work. And if you don't think the city has your back when you're doing such dangerous, hard, stressful work, we can't pretend that doesn't affect the quality of the work and therefore the outcomes that we're going to get from it. So either we're going to get serious about a commitment or we're not. If you're not going to get serious, it will affect your outcomes.
Yeah. Well, I hope folks in Congress are listening, because my understanding is that this is not something that we can just decide to get over or get around. This is a congressional imposition on us that continues to be a hurdle in a lot of different contexts. And this is a particularly important one when we talk about the physical investment that's needed and the message that we're sending to these CBOs and CVIs of that we believe in you and that we believe in the program. And so I just name that as not an excuse for not proceeding, so that we can all think together about another creative way to accomplish the goal with our current structure.
And what I think it's created is a climate of scarcity, right? Where everyone's struggling to get resources, almost like a Hunger Games kind of culture, right? Where no one's very sure about whether they're going to have their job from one year to the next. And quite honestly, and I'll say this is my opinion, I think it often opens the door for corruption.
I want to make one other comment on this, because one, I totally understand how you're boxed in by Congress, so totally get that. I want to go back to Pastor Golston's comments about engagement with philanthropy and business. Really, if you want a sustainable model, there needs to be intentional action to bring all of these partners to the table to do this right. Chicago has done it, I think, very effectively, just as one example. And given the kind of constraints that you're under, I think business and philanthropic support in sort of a strategic agreement that we're going to achieve this together, I think probably, this particular context, it couldn't be more important from my viewpoint.
Mm-hmm. Okay. Thank you.
And I would agree. I appreciate that you invited Kirby Garrity to this conversation, but I would also say, just in my experiences just working in the district, that voice hasn't really been represented at the table in terms of CVI. Like the foundations that are more DC based, this is probably the first time in doing this work within the past few months that I've actually seen foundations taking the lead. And in fact, I just spent the past 4 or 5 months working with community foundations, and DC was part of that. I worked with 4 cities, DC, Denver, Philadelphia, and Indianapolis. And this was the first time I've even sat at the table with program officers from DC that are now really trying to be engaged and support the work. And so I would encourage, and I appreciate that you invited Ms. Garrity to this conversation, and I would hope we would have more support from DC-based foundations in the CVI space.
Absolutely. Thank you both for raising that.